Hi, good afternoon, Rayton. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 23rd of January 2024. How are you doing?
Hi, good morning, Mihiraa. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Rayton Aston.
All right, Rayton, could you please confirm your candidate number?
Yes. My candidate number is 437338239.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Introduce yourself and your professional background.
Hello, my name is Rayton Aston, and I am a registered nurse with over 6 years of experience. I have a strong background in the emergency department, having worked in various healthcare settings, including clinics, hospitals, community health centers, etc. I am dedicated to providing compassionate and quality care to my patients.
Describe a challenging patient care situation you have encountered, and how you managed it.
In a particularly challenging situation, I had a patient with COVID-19 who was experiencing breathlessness. I ensured effective communication with the patient and their family, collaborated with the multidisciplinary team, and implemented a comprehensive care plan. This involved closely monitoring vital signs, oxygen support, administering appropriate medications, and providing emotional support to both the patient and their family.
Discuss a time when you had to work collaboratively in a healthcare team.
Teamwork is crucial in healthcare, and I often collaborate with colleagues to ensure optimal patient care. One instance was when we had a complex case requiring input from various specialties. I actively participated in team meetings, shared information, and collaborated on a cohesive care plan. This collaborative approach ultimately led to positive outcomes for the patient.
Explain a situation where you had to communicate effectively with a patient who spoke a different language.
In a multicultural healthcare setting, effective communication is key. I recall an incident where I had a patient who spoke Spanish, and they didn't speak the language fluently. I utilized interpreter services, used visual aids, and employed gestures to ensure the patient understood their diagnosis, treatment plan, and any potential side effects. This ensured a clear and accurate exchange of information.
Discuss the importance of continuing professional development for nurses.
Continuous learning is essential in nursing to provide the best care possible. I actively engage in ongoing professional development by attending conferences, participating in workshops, and staying updated on the latest evidence-based practices. This commitment not only enhances my clinical skills, but also ensures that I am well informed about advancements in healthcare, ultimately benefiting my patients and the healthcare team.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Good morning. I'm Nurse Rayton Aston. Could you please confirm your name and age for the records?
Good morning, nurse. My name is Mihiraa, and I'm 38 years old.
All right. Please confirm the reason for your appointment today.
Sure, I am here to attend a pre-operative assessment before my inguinal hernia repair surgery, scheduled 4 weeks later.
Thank you for your confirmation, Mihiraa. I'll be explaining your pre-surgery instructions for your inguinal hernia repair today. Don't worry, if you have any questions, I'm here to walk you through everything, step by step. How are you feeling today?
Thank you for seeing me. I'm a little nervous about the surgery, I admit. The main thing I'm wondering about is what I need to do to prepare for the surgery itself.
That's completely normal, Mihiraa. Let's go through it step by step. First, it's important to prepare your body for the surgery. The most important thing is to give your digestive system a chance to rest before surgery. That means to have an empty stomach. We need you to stop eating and drinking anything, including water, 6 hours before the surgery. It might seem challenging, but this helps prevent complications during the operation. And if you have any medications, continue taking them with a small sip of water.
Perfect. I can definitely do that. I'll make sure to set an alarm, so I don't forget.
Now, let's talk about getting a good night's sleep before surgery. Mihiraa, it's crucial to be well rested, so your body can recover better afterward.
I'll definitely make sure to get a good night's sleep.
Excellent. Mihiraa, we recommend taking a shower or bath with specific soap from the pharmacy, both the night before and the morning of your surgery. This helps reduce the risk of infection after the operation.
All right, I will do that. And is there anything else I need to do?
Yes, just a few things. Choose loose, comfortable clothing to wear on the day of surgery, something easy to change into afterward. Also, it's best to leave all valuables and jewelry at home. Bring only essentials, like your phone and personal identification.
Got it. And what about after the surgery? What should I expect?
You may experience some discomfort after surgery, which is normal. We'll provide you with effective pain medication to manage it. Mihiraa, the pain pump will deliver medication directly into your bloodstream, so you can control the pain as needed. Do you have any other questions?
That's good to know. How long will the recovery take?
Remember, Mihiraa, everyone heals at their own pace, but typically, recovery takes 2 to 4 weeks, and you should gradually regain your usual strength and energy within 4 to 6 weeks. It's important to rest comfortably for the first few days and avoid strenuous activities or heavy lifting.
I understand.
Mihiraa, since you'll be a bit groggy after surgery, it's important to have someone drive you home and stay with you for the first 24 hours. This ensures you have all the support you need while recovering. Is there someone to accompany you home after the surgery?
Well, I'll make sure to arrange that.
Fantastic. Mihiraa, can I have your consent to begin your pre-procedure assessment?
Yes, of course. I consent to you.
Thank you, Mihiraa. Well, before concluding, let me summarize what we have discussed so far. You came in for a pre-operative assessment before your inguinal hernia repair surgery, scheduled in 4 weeks. We covered important pre-surgery instructions. Firstly, it's crucial to have an empty stomach 6 hours before surgery to prevent complications. You can continue your regular medications with a small sip of water. Getting a good night's sleep is advised, and it's recommended to shower with specific soap before surgery to reduce infection risks. Mihiraa, you should wear loose, comfortable clothing on the surgery day, leaving valuables at home. After surgery, expect some discomfort, but we'll provide effective pain medication via pump for control. Recovery typically takes 2 to 4 weeks, with a gradual return to normal activities in 4 to 6 weeks. Arrange for someone to drive you home and stay with you for the first 24 hours after surgery. Remember, Mihiraa, we're here to support you, and feel free to reach out for any clarifications or questions. We also have resources on inguinal hernia repair and recovery if needed. How are you feeling about the information, Mihiraa?
Thank you so much, nurse. This has been really helpful. I feel much more prepared now.
You're welcome, Mihiraa. We look forward to seeing you on the day of surgery. In the meantime, if you have any questions or concerns, please don't hesitate to contact us.
All right. That is the end of your OET-speaking role play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.